Thank you, Madam Chair. You know, when the little guys, doctors' offices or pharmacies are caught breaking the law, they sometimes get kicked out of the Medicare program. But the consequences for giant corporations are very different. Instead of kicking these big-time bad actors out of the Medicare program or putting CEOs in jail, the government settles with a fine and the company enters a corporate integrity agreement, basically a promise not to break the law again. So I want to consider one for-profit hospital chain, Tenet Health. It's a $5.8 billion corporation. Now, back in 1994, Tenet paid a $379 million fine, suggesting some pretty serious activity here, for illegal kickbacks to doctors, and it signed one of these corporate integrity agreements. Then in 2006, Tenet got caught fraudulently billing Medicare and giving illegal kickbacks to doctors, for which they paid a $900 million fine, suggesting some pretty significant activity here, and signed a new corporate integrity agreement. Then in 2012, Tenet admitted to breaking the law again while under the 2006 corporate integrity agreement, and it paid a $42 million fine. And then just a year later, Tenet got another $4 million slap on the wrist for misconduct that occurred while they were under the corporate integrity agreement. So if a big company can commit major fraud again and again and again, and each time they just pay a fine and promise to be good and move on, I'm not sure what incentive there is for them to stop breaking the law. So, Dr. Agrawal, why is it that a company like Tenet, and we know about lots of other examples, are allowed to settle allegations of fraud over and over with just a fine and a promise not to break the law again? When is it that you say enough is enough?
Senator, thank you for the question. We are an administrative agency, as you know. We have a variety of authorities that allow us to review medical records, recover overpayments, deny enrollment, revoke enrollment. From our perspective, there is no such thing as too big to fail. There's no provider that we can't medically review. In fact, some of the providers that you cited, we have conducted medical reviews of and secured overpayments. We perform the same screening activities for those providers. And we have revoked or kicked out of the program institutional providers on, larger institutional providers. With respect to settlements and CIAs in particular, those are activities that we as an administrative agency don't engage in. Those are conducted by the DOJ and Office of Inspector General. I couldn't really address for you what their thresholds are for taking action beyond those.
So fair enough that you don't speak for them. But you testified here last year, and when you did, I asked you about how CMS, the HHS Inspector General, and the DOJ don't coordinate their actions to deter these bad corporate actors. As the director of the Center for Program Integrity, have you worked with HHSIG and the DOJ to implement any shared policies or guidelines among the agencies that will help assure that the actions taken by one agency, like imposing a fine and putting in place this corporate integrity agreement, will be strong enough to defer future corporate bad acts? What have you done since we met last time?
I completely remember that line of questioning.
Good.
So
I thought you might.
we work very closely with the Office of Inspector General on a daily basis. We coordinate with them on investigations. We make referrals to them on a routine basis. We referred thousands of cases in the last year to the OIG for further investigation and their actions. They have full access to all of our data analytics and other systems so that they know what we are working on. They have real-time access to the same data that we do. And indeed, we coordinate on cases where if it looks like we want to take a revocation action, we coordinate with them and make sure that they're aware of that action.
Well,
there are certain authorities.
That sounds good. It sounds like you're working together.
It is promising. There's more.
All right.
There are certain authorities that they have, such as exclusion authority, that I think is very useful. And obviously they leverage whenever they can. That exclusion authority goes beyond kicking somebody out of Medicare. It keeps that person or that entity from getting any healthcare dollars. So we do make referrals of cases to leverage that exclusion authority. And another area of collaboration, there's a legislative proposal in the president's budget around expanding that exclusion authority. We are very supportive of that because it is another place where we can work together.
Okay, so but let me just try track this down just to make sure I realize I'm running out of time, but I just want to see if I can finish this point. So you are working together. You're making referrals. Do you know if DOJ and HHS-IG have official policies or informal practices with regard to whether or not they're really deterring future wrongdoing? I don't understand how Tenet can keep showing up like this in the records, promising not to break the law and breaking the law over and over.
In my day-to-day interactions with the IG and DOJ, it's very clear to me that they are committed to stemming as much healthcare fraud as possible, either by kicking entities out of Medicare or the healthcare system or getting them into compliance. I think the specific policies they'd have to reference, but I've seen nothing in my daily interactions with them that would suggest otherwise.
Well, let me tell you the part I see, and that's the part where we're watching the same actors appear again and again and again, which suggests to me that whatever it is you're doing or they're doing is not getting us where we need to be. And the consequence of that is we're seeing repeating bad acts, and the American taxpayers are losing a lot of money over this. Companies should not be allowed to get away with fines and a promise that they will do better in the future and a wrist slap. Until we get serious about holding these big bad actors accountable when they defraud Medicare and Medicaid, the big guys who cheat the system are not going to have a reason to stop. Thank you, Madam Chair.